As you previously conducted research on man therapy in Michigan and have published the results, what are the main takeaways we should know about man therapy?
That's a great question. As the principal investigator for the man therapy research, it's been such an honor to work with folks throughout Michigan and everybody at Grit Digital on the man therapy team as we studied to see if man therapy was effective in not only reducing symptoms and signs of depression and suicide ideation, but also does it help to encourage help-seeking behavior with men ages 25 to 64. So the 5-year study that you're asking me about was a randomized controlled trial funded by the CDC, and we worked with partners throughout Michigan to recruit men to do screening online and to explore the Man Therapy website and to test out how screening and referrals to resources, as I mentioned earlier with the outcomes, may have impacted mental health and suicide prevention and help-seeking behaviors. So some of the main takeaways that we found were that men in our study reported over time a reduction in depression and suicide ideation. This was true actually for both of our treatment groups, and really a very positive result that we found as one of the first large studies for middle-aged men to think about how online digital tools with screening and referrals such as man therapy can help to reduce depression and also suicide ideation. For the men who were in our man therapy group, they also reported significant reductions in the number of poor mental health days over the course of a month. They also reported improved problem solving as it related to social support and reaching out to others for help. And they also reported increased motivation to seek treatment. So we did a second analysis with men in man therapy in our control group. And we actually found statistical differences where men in the man therapy group reported increased help-seeking behaviors, specifically our formal help-seeking behaviors, things that we talk about, like meeting with a mental health counselor to start therapy, meeting with a primary care physician about mental health, and also using the online treatment locators to help find a counselor. So overall, very positive results for man therapy and for different public health campaigns like man therapy to reach men in the community and to encourage help-seeking behavior and improved mental health outcomes.
You are continuing your research with a new study on man therapy in Michigan. How has the study been going this time since you have previously developed relationships with those in the community?
So now that we've started the new study, also funded by the CDC, it's funded as part of the Michigan PRiSMM project, which is preventing suicide in Michigan men. We have been able to launch all of the creative designs from man therapy, since we're not testing them like we were before in a randomized controlled trial. And it's opened up to fabulous new partners all throughout the state. So when we did the original study, we ended in 2019 with about 230 promotional partners or organizational leaders and stakeholders throughout Michigan that are promoting man therapy. After just 1 year of relaunching and rebranding as Man Therapy Michigan, we have over 570 partners now that are actively working to integrate man therapy as part of their suicide prevention interventions and campaigns. So we've been recruiting men for the new study. We're not doing a randomized control trial, but we are doing a 1-month pre and post-test follow-up. We've had a great response so far throughout Michigan for men ages 25 to 64. And even within our preliminary data analysis, we're already seeing improved results over a 1-month time for depression and help-seeking behaviors. So we're excited to continue this work with our partners in Michigan. Many of them have been centering man therapy as part of their suicide prevention campaigns in the community, in the workplace, in a lot of different settings. And they've been really excited to use some of our new creatives. Particularly, they are engaging in creating public service announcements, flyers, handing out materials at community and workplace wellness events, using things like bathroom ads for man therapy with QR codes, which, by the way, account for about 25% of our traffic to the website in Michigan, and are even getting creative with partners. We've got some partners coming out with a soccer jersey for Man Therapy, and we've had some wonderful partners that have created koozies to be able to use them at different events as well.
Man Therapy Michigan gives partners access to real-time data about their users who visit mantherapy.org from their area. How have partners used this data to expand Man Therapy throughout their community and support their local programming?
It's been great to re-engage with our original partners from the first grant and to develop new partnerships throughout the state of Michigan. We've been working hand in hand to make sure that our Google Drive, for example, has shovel-ready tools that individuals and organizations can easily access whenever they need them. Some of the tools in our Google Drive for Michigan are specific with Michigan Man Therapy creatives. Others have national Man Therapy branded materials that can be downloaded, can be printed, can be shared, can be resized to use on different types of swag at events. And the partners are very excited and are using the materials, as we're seeing evidenced by men coming to the site throughout the state and also engaging in the evaluation study. We've been doing some data analysis to actually look at some of the regions, and our preliminary data shows us that where we have strong active partners throughout Michigan that are using the Man Therapy materials as part of their public health and suicide prevention campaigns, we're actually seeing increases on our data dashboard for Man Therapy as to how many new people are coming to the site. For example, a number of our regions that have both a mixture of the high touch, boots on the ground promotion, as well as our high tech promotional interventions that are happening throughout the grant, are seeing 50% or more increase of unique users coming to the website over the course of 1 year. So very exciting. And with this new Man Therapy Michigan project, we've been able to create data dashboards with Grit Digital that owns Man Therapy to provide our partners with 24-hour real-time access to data. And this has really been a groundbreaking part of the new project, because our partners, as they are promoting Man Therapy, whether it be a wellness walk, an awareness campaign, maybe they're doing a sporting event and they're able to have a billboard or a table about Man Therapy, they can actually log into the online dashboards and see if utilization in their region and even their county has increased after specific campaign pushes and marketing. So we have found from our partners, we recently did a survey, and 40% are actually using this data not only to inform their public health campaign interventions, but they're actually including the data into their reports and into grant proposals. So having the partnerships has been wonderful, and being able to give data to the partners in real time, I think, is a real benefit of the partnerships that we're finding in Michigan with our Man Therapy Michigan campaign.